So friends, now we'll talk about the muscles of the anterior triangle. You know the anterior triangle has three types of muscle: the superficial musculature, that is your sternocleidomastoid, the infrahyoid muscle, and the suprahyoid muscle. So first we'll discuss about the sternocleidomastoid muscle. So from where this sternocleidomastoid muscle originates? It originates from your mastoid process of the temporal bone. And where it gets inserted? It inserted part into the sternum and part into the clavicular. They have two heads, that is the sternal head and the clavicular head. Okay my friends, so what is the action of this sternocleidomastoid muscle? It rotates the head to the opposite side and help in the flexion of your neck. It is innervated by the spinal accessory nerve. Okay, so why this sternocleidomastoid muscle is important? It is known as Pandora's box because most of the important structures of neck are overlapped by this muscle. And even one more thing, applied anatomy, that's rhinic and spasmodic torticollis. So whenever your sternocleidomastoid muscle is short, it is known as rhinic. In that the patient or the subject is unable to rotate his neck. Second is spasmodic torticollis. That is a painful contraction of your sternocleidomastoid and trapezius muscles. Why this spasmodic torticollis happen? It happens due to the overexposure of cold, then by the malalignment of your pillows, and sometimes it is psychogenic in cause. In very severe cases, that where the pain is so much, it requires the suctioning of your spinal accessory nerve. So friend, that was the sternocleidomastoid muscle.